right, switching gears now, in depth, and there are different benefits that people look for when they're getting a job. Sometimes it's the pay, other times it's the medical benefits, and now some are looking at fertility benefits as we hear more now. All right, Dr. Mark Trolice joining us today. Good to see you. Thanks for coming in.
My pleasure.
Let's talk about this. Parents now looking specifically for fertility treatments as an employment benefit. What are you seeing?
Well, it's increasing now. Employers are now providing insurance coverage for fertility patients, and it looks like we're reducing the pre-authorization. Starbucks was a pioneer in giving it to the frontline employees, the hourly employees, but that's also starting to increase in other companies. So this is a huge benefit for patients.
Is this kind of it's about time?
Oh, absolutely. It's awful, the insurance coverage for fertility patients. Florida does not have very good coverage. It's not a mandated state. There are about 16 states in the country right now that provide some degree of insurance mandated coverage for infertility patients. But it's about time. The World Health Organization years ago designated infertility as a disease. This should be covered, and patients shouldn't have to beg, borrow, and steal for insurance coverage or for payment for infertility because it's expensive.
Well, let's look at this. Mercer, which is a benefits consulting firm, said 44% offered some sort of IVF, which is in vitro fertilization benefit last year, compared with 37% in 2017. So why are we seeing the change?
I think it's twofold. One of them is that it's to empower patients, and I think companies are realizing that infertility is a disease. The second is to ingratiate themselves with their employees. Mm-hmm. They're seeing that employees value their company and will stay with their company longer if they provide them the benefits that are appropriate. So it's definitely long overdue. And I applaud the companies for doing this, but we need more.
Well, oftentimes you'll hear somebody say they're changing jobs. They don't like the job climate, they don't like the situation they're in, but more so, they don't like the medical benefits. The medical benefits are too high. I want to get a job where the medical benefits are lower, easier to afford. Do you think someone would consider changing jobs for the better reproductive health benefits?
Absolutely. I've seen that personally. Patients will shop around and work somewhere where there is fertility coverage. Eric, IVF, which is the most aggressive form of therapy that we have, it's assisted reproductive technology, it's not 100% successful. It's probably close to around 50% on average. So with that, it's very difficult for couples to go to the degree of spending $15,000 or more, depending upon where they live, for a treatment that is not a guarantee. And so I think companies are realizing that, and I'm hoping and praying that state governments will start realizing that this is a disease that needs to be covered for patients instead of them having to pay out of pocket.
And going forward, do you think it's going to be a trend where more will?
It's slowly increasing. Once again, about 16 states in this country cover. 5 states are offering some fertility preservation coverage. Fertility preservation is where patients are freezing their eggs or sperm or embryos because they're being given cancer diagnosis and they have to get treatment, and the treatment can actually affect their fertility. So it's a slow trend. I'm going to be in Washington next month advocating for better coverage for a specific condition called polycystic ovary syndrome.
Which we've had you in for before.
Yes, PCOS challenge.
Sure.
So we're going to be going there advocating for more benefits for insurance coverage and for research as well as treatment.
Okay, well, we've had you in for that already, and I'm sure we'll want to do an update when you return from D.C. So keep us posted on that. Thank you for coming to talk about this, Dr. Mark Trolice. Always a pleasure.
My pleasure.
Good to see you.
Thank you.
All right.